You can go ahead.
Thank you so much for joining us today. I'm Linda Hopkins, Supervisor for Sonoma County's 5th District and the current Chair of the Board of Supervisors. Welcome to our COVID-19 update for Wednesday, September 22nd. Let's begin with a brief message from Gilbert Martinez from our communications team for our Spanish-speaking viewers. Gilbert?
Gilbert, we're not hearing you.
Still not hearing you, Gilbert. Would anyone else be able to get the message, since I think we're having some challenges with Gilbert's audio? Sylvia, would you be able to help us?
Hi, Supervisor Hopkins, can you hear me now?
Yes, wonderful. Some behind the scenes wrangling.
Y bienvenidos a la sesión informativa organizada por la supervisora Hopkins y doctora Mace. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Y ahora regresamos para atrás con supervisora Hopkins.
Thank you so much, Gilbert, and sorry for the technical difficulties all as we get going. So the news of this week is that we do continue to focus on getting people in our community vaccinated as quickly as we possibly can. We now have been able to vaccinate 76% of our eligible population, with another 7% of our population being partially vaccinated. I'm very proud to say that we are one of only 11 counties out of 58 in the state of California that has a vaccination rate above 70%. I'm also proud to say that the state of California now has the lowest COVID-19 case rate in the nation, according to the most recent data from the CDC, and it's not even close. The nation as a whole has a case rate, sadly, that is nearly 3 times the rate of California, at about 251 new cases over 7 days per 100,000 people. Meanwhile, California's 7-day rate is about 95 new cases per 100,000 people. Connecticut has the second lowest case rate at 127, followed by Colorado at 128. That is to say that we have come a long way since 2 months ago when COVID cases in the state were surging due to the Delta variant. Thankfully, the majority of residents have responded by wearing their masks when asked to do so, following other health guidelines, and most of all, and most importantly, by getting vaccinated. That remains the most important tool that we have to get us past this pandemic. Locally, our case rate in Sonoma County has been dropping as well, and we'll be getting into details about that in just a few minutes. One of the things that we wanted to go over today is the issue of booster shots. We've certainly been getting a lot of questions from constituents about that lately. We know that many of you have questions about whether you'll need a booster, and if so, how soon you might be able to get one. As you may know, an advisory committee for the U.S. Food and Drug Administration last week approved booster shots for the Pfizer vaccine for people 65 and older and other high-risk Americans. They did this based on evidence that showed that these residents were at a higher risk of severe COVID-19 outcomes, and that they may be more likely to have waning immunity after the first 2 rounds of shots. Advisors to the U.S. Centers for Disease Control and Prevention began meeting today and are expected to decide on whether to endorse these recommendations. If and when the Centers for Disease Control and Prevention sign off, which could happen this week, booster shots would be available to these residents. We will be encouraging residents to go through the myturn.ca.gov website to make appointments for these shots. For those who have healthcare coverage through one of our larger local medical providers, such as Kaiser, Sutter Health, or Providence, we will be encouraging you to contact your primary care physician to determine whether you are eligible for a booster and to go ahead and make an appointment. Meanwhile, our focus remains on administering first and second doses to anyone who is not yet fully vaccinated. Looking at our case rate today shows why the vaccine is so important. In Sonoma County, only 24% of the population is not fully vaccinated, yet that group accounts for 4 times the COVID infections. Our case rate among vaccinated individuals is 3.9 per day per 100,000, but it is 16 per day per 100,000 among the unvaccinated in our community. While our case rate is continuing to drop, which is a positive and promising sign, the Delta surge still isn't behind us, and we do need to continue to remain vigilant, especially with fall and winter approaching. Now, for more on the current state of the pandemic here at a local level, I'd like to go ahead and turn it over to Dr. Sundari Mace, Sonoma County's Public Health Officer. Dr. Mace?
Thank you so much, Supervisor Hopkins. As Supervisor Hopkins just said, the good news is that our case rate is starting to decline. Our overall testing positivity rate is 2.6%, and our combined vaccinated and unvaccinated case rate is down to 13.5 cases per day for 100,000 residents. I am cautiously optimistic that the worst of the Delta surge is over, but I'm concerned that we're still seeing younger, unvaccinated individuals in the hospital with severe cases of COVID. In fact, according to the CDC, 18 to 24-year-olds are 24 times more likely to end up in the hospital with COVID if they're unvaccinated. Currently, 52 people are hospitalized with COVID in Sonoma County. Since the school year began last month, there have been a total of 385 positive cases related to schools, which includes 350 cases in students and 35 in staff. The majority of those cases, 224, have been in elementary schools, which is the youngest group, and the most likely reason is because they're likely to be unvaccinated. As of now, we're not mandating that eligible children be vaccinated as a requirement for school attendance, but there is a long history of mandating vaccines in school-age children. California has mandated that school-age children be vaccinated against 10 vaccine-preventable diseases. These include measles, mumps, rubella, polio, and diphtheria, tetanus. So we will continue to monitor the situation once all school-age children are eligible to be vaccinated against COVID. We're constantly making sure that all of our health orders are in order, including the mandate that requires face coverings indoors, which does not have an expiration date at this time. Given that wearing face coverings is one of the easiest and most effective tools we have at our disposal to prevent the spread of COVID, and that we still are in a surge in terms of local transmission, we will continue to require wearing the facial coverings as long as necessary to keep our community safe. Finally, as fall and winter are approaching, flu season will soon be upon us. I would like to reiterate my strong recommendation that everybody get a flu shot in addition to their COVID vaccine. Now I'll turn it over to Dr. Irma Shende, Sonoma County's vaccine chief, for more information on our vaccine campaign. Dr. Shende.
Thank you, Dr. Mace. Let's talk in more detail about third doses and booster shots and try to provide some clarity. First, the only group that has been approved at this time for a third dose of a COVID vaccine are those who are immunocompromised. As Supervisor Hopkins noted earlier, advisors to the CDC are currently reviewing the FDA's approval of a booster shot for people 65 and older, or those who are at high risk for COVID, for severe COVID. That group only includes those who got their first and second dose of the Pfizer vaccine, not the Moderna or the J&J vaccine as of yet. This group is eligible 6 months after their second dose. So basically, if boosters were approved today, those eligible would have received their second dose in by late March, and beginning next week, about 135,000 Sonoma County residents would be eligible for boosters if they are approved this week. When you're eligible to receive a booster, the best option is to go to myturn.ca.gov website. Once again, that's myturn.ca.gov to make an appointment at a local pharmacy. For now, county-supported vaccine sites will continue to focus on those who have yet to receive their first vaccine dose as well as their second dose. On the question of vaccines for younger children, it was good news to hear the data from Pfizer this week that shows that the vaccine is safe and effective for children aged 5 to 11. It could not come at a better time. Children under 18 now account for more than 1/5 of all new COVID cases nationally, and the Delta variant is sending more children to the hospital than at any other time during the pandemic. Although here in Sonoma County, we continue to have few pediatric cases. I'm hopeful that the FDA will review the data from the Pfizer study and make a recommendation by late October or early November. It's critical that we start to get young children vaccinated, while at the same time explore vaccines for children younger than age 5. Our youngest eligible population, the 12 to 15-year-olds, are now 58% fully vaccinated in Sonoma County, and another 8% are partially vaccinated. Overall, our vaccination rate is 76% of the eligible population being fully vaccinated, with another 7% partially vaccinated. So we're making good progress in our campaign to get our first and second doses into arms as we make plans to offer booster shots and expand our eligibility to our youngest residents. With that, I'll turn it over to Kate Pack, our lead epidemiologist, to share some data. Kate?
Okay, thank you, Dr. Shende. I'm just going to pull up my slides. Okay. Okay, I'll just briefly review our daily metrics. As others have mentioned on this call, we are seeing a positive trend in terms of declining new cases per 100,000 residents per day, as well as declining test positivity. As of today, we're at 13.4 new cases per 100,000 residents per day, 2.5 overall test positivity, and roughly similar 2.7% test positivity in the lowest healthy places index quartile. Those are the regions of our county where residents have less access to resources to support their health and well-being. We're also beginning to see a decline in COVID-19 hospitalizations. As of data reported by the hospitals yesterday, there were 51 individuals hospitalized with COVID-19 in our county. Of concern, 62 people have died from COVID-19 since July 1st. The trend that we are seeing with the declining case rates, this mirrors what we're seeing across the Bay Area in terms of decreased transmission. It is important to note, though, looking at the old blueprint for a safer economy framework, looking at that framework, we would still be in the purple tier, indicating widespread transmission, but things are starting to move in the right direction. And you can see that in this slide as well. This orange line represents the case rate, or the new cases per 100,000 residents by vaccination status. So the orange line is unvaccinated, and this blue purple line represents fully vaccinated residents. So you can see that we are seeing the same downward trend in this chart. And as of today, the case rate is 10.4 among unvaccinated residents and 2.8 new cases per 100,000 among fully vaccinated. Looking at case rate trends by race ethnicity, we see that while the majority of cases in the last 60 days occurred among white residents and Latinx residents, when we take into account the population size of different racial ethnic groups, we see a disproportionate impact in terms of number of cases in the last 60 days among Pacific Islander residents, American Indian Alaska Native residents, and Black African American residents. Looking at trends by city in the past 60 days, we see that the greatest number of cases are occurring in Santa Rosa, in Petaluma, in Rohnert Park, and in Windsor. However, factoring in population size, we see that the weekly rate of new cases per 100,000 is currently highest in Sebastopol, in Cloverdale, as well as in Sonoma. Looking at cases by age in the past 60 days, we continue to see the majority of cases in the 20 to 29-year-old and 30 to 39-year-old age groups, followed by those 40 to 49 and 10 to 19. And these charts show the trends that we've seen in these age groups over the past 60 days. Looking at our testing volume, we have seen a great increase. Looking in just the past months, we've seen a 27% increase and a fourfold increase in testing among children aged 5 to 17. We're conducting 737 tests per 100,000 residents per day. And as you can see, we have reached the level of testing that we were seeing during the winter surge. Looking at source of infection, there remains to be roughly half of the cases where we aren't able to pinpoint a specific source of transmission. And that can be because individuals prefer not to share details with contact tracers, or they may not recall where they were infected. But among cases where we do have enough information to determine a source of transmission, among active cases, household transmission remains the most common, followed by gatherings and workplace transmission. This brown area represents community transmission, such as transmission at restaurants and other locations. Looking at our school cases, as Dr. Mays had mentioned earlier, we've seen 385 school-related cases, with the majority of those occurring in elementary schools, with 350 student cases and 35 staff cases. 60 of these 385 cases were confirmed to have occurred on campus. The transmission occurred on campus in terms of someone was either a contact to a known case on campus and then they became positive themselves, or through the case interview, we were able to determine that exposure on campus was the most likely source of transmission. Looking at our hospitalizations, as Dr. Mays mentioned earlier, the CDC has shown nationwide that when we look at the 18 to 49-year-old age group, the rate of hospitalization among unvaccinated is 24 times higher than fully vaccinated individuals. For 50 to 64-year-olds, that hospitalization rate is 19 times higher. And for those over 65, it's 13 times higher. We have seen similar trends globally with increased hospitalization rates among 50 to 64-year-olds, as well as 18 to 49-year-olds. This chart shows a snapshot of all the individuals hospitalized in our county as of last Friday. The blue represents unvaccinated individuals and the pink represents fully vaccinated individuals. And this is by age group. What we have seen in terms of trends is that those who are fully vaccinated and hospitalized tend to either be of advanced age or have serious underlying conditions, and they tend to be those kinds of conditions that we see in the group of immune compromised individuals who are now being offered third doses to increase protection. So those with organ transplant recipients and cancer patients and other individuals who have conditions that may be impacting the effectiveness of the vaccine. But we are seeing a trend in terms of seeing younger individuals hospitalized with COVID-19, particularly unvaccinated. Looking since June 1st, 80% of all hospitalizations have been among unvaccinated. Looking at our vaccine administration, as Dr. Shende mentioned, we are now at 76% of the population fully vaccinated. When we look by age group, we continue to see the majority of cases occurring in these younger age groups. However, we are seeing positive trends in terms of increases, particularly in the 12 to 15-year-old age group, of more and more individuals becoming vaccinated each week. We're also seeing progress when we look at vaccination rates by race and ethnicity, where we see a smaller proportion of the Latinx community and multiracial residents who are fully vaccinated, represented here by the blue. We continue to see an increase of about 2% or so in terms of the number of individuals who are fully vaccinated in the Latinx community. Looking at our vaccine equity measures, 26% of all doses have gone to those who live in the lowest quartile of the Healthy Places Index, with 66% of those individuals fully vaccinated. And that is the end of my slides.
Great, thank you all for sharing this important information as part of our COVID update for Wednesday, September 22nd.